DOLA Pro Advanced Customisation. Metatarsal Dome. A metatarsal dome is a tear-shaped pad added to the top surface of an orthotic under a top cover for long-term protection. It is highest in the centre and tapers at the edges. The DOLA metatarsal dome height has been selected based on feedback from health professionals and is a reduced height compared to other manufacturers to improve patient comfort and tolerance. The DOLA Poron metatarsal domes are self-adhesive with 3M backing tape and are available in 4 sizes: small, medium, large and extra large to cover paediatric to adult patients. Metatarsal dome shape. The dome can be left as standard as out of the packet or can be customised in terms of its dimensions, height or cutouts. Metatarsal dome positioning. A standard position for the dome begins at the midshaft of the metatarsals and extends to just proximal to the metatarsal heads. They can be placed with the apex of the dome at a metatarsal head, example 2, 3 or 4, or at an ID space, example 2, 3, 3, 4. Treatment-directed testing. Treatment-directed testing of the metatarsal dome size and position can be performed on the patient's foot, shoe insole, or on the orthotic shell. This can be used to test for clinical effect, patient tolerance, and comfort. Note: securing the metatarsal dome with strapping tape or hyperfix will allow for adjustment of dome location in treatment-directed testing. Customised positioning. For a custom position, mark the position required on the patient's foot and transfer to the orthotic. Start by marking the required location on the patient's foot. This is commonly an anatomical landmark, metatarsal head or ID space, or a pathology location. Use a pen or lipstick to mark a location for the metatarsal dome on the plantar surface of the patient's foot in a non-weight-bearing position. To transpose the mark onto the DOLA Pro orthotic, position the patient on the orthotic in a weight-bearing position and apply body weight. The mark will now be transposed onto the orthotic shell, giving a guide for the position of the metatarsal dome addition. Metatarsal dome orthotic addition. Select the required metatarsal dome size and place the metatarsal dome on the dorsal surface of the orthotic. Secure with strapping tape or hyperfix for treatment-directed testing, or peel and stick the self-adhesive 3M tape for orthotic manufacturing. Protect the Poron metatarsal dome with a top cover for long-term use and dispense. Metatarsal dome case examples. In this case example, a size small Poron metatarsal dome was placed in position 3 on a size small DOLA Pro 70 soft density full-length orthotic shell. The prescription was completed with an intrinsic rear foot varus post grind of 4 degrees and covered with pink semi-perforated DuraFit full-length top cover, with fitting to a woman's Asics Keanu 27 size 9. In this case example, a size large Poron metatarsal dome was placed in position 3 on a size medium DOLA Pro 80 medium density full-length orthotic shell. The metatarsal dome was customised with a cutout after successful treatment-directed testing. The prescription was completed with a full-length slow-release Poron mid-layer with a plantar fascial groove accommodation, an intrinsic varus rear foot post grind of 4 degrees, and covered with a stone semi-perforated DuraFit full-length top cover to protect the Poron additions. In this case example, a size large Poron metatarsal dome was selected from the 4 size options available and placed in position 3. A size medium DOLA Pro 80 medium density full-length orthotic shell was selected for a men's size 9 to 10. The orthotic was covered with a beige semi-perforated DuraFit full-length top cover to protect the Poron additions. In this case example, a size medium Poron metatarsal dome was placed in position 4 on a size medium DOLA Pro 85 hard density full-length orthotic shell. The prescription also included a Poron forefoot extension to address symptomatic forefoot pathologies during weight-bearing activities. The prescription was completed with a choice of top cover to protect the dorsal Poron additions. In this case example, a size small Poron metatarsal dome was selected from the 4 size options available and placed in position 2. This metatarsal dome position and size was selected based on treatment-directed testing with successful reduction of the patient's neuritis symptoms. A size large DOLA Pro medium density 80 full-length orthotic shell was selected for a men's size 11 to 12. The metatarsal dome was protected with a stone, semi-perforated, DuraFit full-length top cover. In this case example, a size medium Poron metatarsal dome was placed in position 3 on a size medium DOLA Pro 85 hard density full-length orthotic shell. The prescription also included a Poron forefoot extension, customized with a slot. A metatarsal dome is commonly combined with other forefoot additions and modifications, including forefoot extensions and cutouts. The prescription was completed with a choice of top cover to protect the dorsal Poron additions. In this case example, a size large Poron metatarsal dome was placed in position 2 on a size medium DOLA Pro 85 hard density full-length orthotic shell. The prescription also included full-length slow-release Poron midlayer, protected with a full-length skin DuraFit top cover, and a 4-degree intrinsic varus rear foot post grind. The full-length DOLA Pro is available in 3 densities, soft 70, medium 80, and hard 85, across 11 sizes, from a kid's 5 to a men's 15 plus. Metatarsal dome prescription. The modification of an orthotic shell with an addition of a metatarsal dome is used to influence forefoot pressures, forefoot function, and reduce symptoms of pathologies including metatarsalgia or general forefoot pain, neuroma, neuritis, capsulitis, bursitis, forefoot hyperkeratosis, plantar plate injury, and digital deformities. Metatarsal dome in clinic modification. Adding a metatarsal dome to an orthotic shell is a common in-clinic modification. The following video will show you how easy it is to add a metatarsal dome to your orthotics in clinic.